wanted to talk about the recovery from a breast augmentation. And so the submuscular augmentation or under the muscle, the recovery is a bit more than on top of the muscle or what is called a subglandular augmentation. With a submuscular augmentation, you have to be careful about flexing the muscles on your chest wall. And so the first 2 weeks after surgery, I want you to keep your arms really quiet, and I want you to keep your arms mainly down at your side. After 2 weeks, you can start to be active. You can start to move your arms up and move them around, but I definitely don't want you to do any weight-bearing pec exercises or something like Pilates, which is very popular right now. And even after 6 weeks, it will be uncomfortable because the muscle is now in a new position and it can be fairly tight. So when the implant is underneath the muscle and you flex your pectoralis muscle, you will get some movement of that implant. And that can be bothersome at first, but most patients over time will get used to that. And over time, it's not an issue. As far as sleeping goes, I generally like people to try to sleep on their back, particularly that first 2 weeks. If they can, up to 6 weeks, I would prefer that. And I generally want people to wear a bra for the first 6 weeks after surgery. I definitely would like you to avoid trying to lay on your stomach, because if you are on your stomach, it will push down on the implant and it can lead to some bottoming out over time. Now, people sleep how they sleep. I always tell my patients if they slept like a vampire like this, it would be best for everything as far as aging of your face, your breast, etc. But that's just not the reality. And so, if I get 2 weeks out of you, great. If I can get 6 weeks, even better. But after 6 weeks, you're gonna go back to kind of sleeping how you want to sleep. And then as far as the implant itself, it takes about 3 months for that implant to settle. So, don't go out and buy a bunch of new bras right away. I usually tell patients wait about 3 months, and then what you see is what you get. As far as sexual activity, I think it's more about how much motion you're doing with your arms. Typically at 2 weeks, I'm fine with you getting your heart rate up, but gentle sex, not aggressive sex, that first, during that first period. 6 weeks out, you can do whatever you want. If you've had your breast augmentation in a subglandular fashion or having the implant placed on top of the muscle, I'm generally a lot more liberal as far as the activity post-operatively, and the recovery is a lot faster than if you put it underneath the muscle. The first week, again, pretty careful. After the first week, you can start to go back to most activities. 2 weeks, I usually let people go back to normal exercise other than doing, chest wall activities, push-ups, Pilates, things like that. But you don't have the pain with a subglandular augmentation, and you don't have animation deformity associated with it. So, most people can go back at 2 weeks to doing most things. When you have your breast augmentation, you'll wake up and you'll have a post-surgical bra on, and it's a bra that zips up the front. And there's no magic to that bra. I usually like people to buy a couple of other bras that zip up the front, and you can wear whatever one is most comfortable for you. And I want you to use those for about 6 weeks after surgery. I want you to avoid underwire bras for about 3 months after surgery. So with all my breast augmentations, I typically will see the patient anywhere from 2 to 4 days after surgery. And then we will see you back at 2 weeks to remove the little sticky tapes that are on the incision line. Then at 6 weeks, 3 months, and then once a year. And I like to see people once a year almost indefinitely, just to make sure they're not having any problems, that they're getting their mammograms, that they're supposed to be doing that, and that they're doing regular breast exams.